Okay.
Is it recording?
Say that you're just the three participants listening to me. Or the three participants listening to Preston story.
Okay.
Okay, and these are the three handouts for the presentation. Okay, my presentation is on my final assessment for my research methods for professional communications class. The topic that I did mine on is diabetes, and more importantly, the improvements that can be done to challenge the effects of diabetes here in the United States. To start with, I'm just going to go over what exactly diabetes is. Basically, where the body has an inability to produce insulin for the body. And to start with, there are two types of diabetes. There's type 2 and there's type 1. Type 2 is basically the gist of it is where your body doesn't produce any insulin, or it produces very little traces of insulin, or your body becomes resistant to insulin. Type 1 is where your body doesn't produce any insulin at all. And then for some statistics for diabetes, this is a combination of both type 1 and type 2, and it's only in the United States. 29.1 million people have diabetes in the United States, and then more importantly, 86 million people, more than 1 out of 3 adults, have prediabetes. That's before they even know it, before the symptoms begin with the diabetes. 15 to 30% of people with prediabetes will develop type 2 diabetes in 5 years. And then in adults, type 1 diabetes accounts for approximately 5% of diagnosed cases of diabetes. That's the type that I have. $245 billion is the total cost and lost work of wages for people with diagnosed diabetes. That comes from anything from medical supplies to doctor visits to hospital stays when patients are diagnosed with type 1 or type 2. Risk of death for adults with diabetes is 50% higher than for adults without diabetes. And finally, currently at least 1 out of 3 people will develop type 2 diabetes sometimes in their life. And then my presentation for my research methods for professional communication, the presentation goes into now the improvements that can combat these two types of diabetes. To begin with my literature review that I did, it went into detail about the combatant of combating the disease within schools, and more importantly, kind of teaching the students who have diabetes, whether that be type 1 or type 2, things that they can do within the school that can kind of help them understand that it's not something to be ashamed of. The first one I will go into is the location of the treatment for students with diabetes, whether that be type 1 or type 2. Basically, for this part, the location of the treatment really does have an impact on the students in the school that have the disease, whether that be taking their medication down in the nurse's office, in the classroom, who's present, watching them do this. This plays a huge impact on how they feel about the disease going forward. Second, how impacted the child is by the faculty, the nurses, any those teachers, anyone that can help them with their disease. More importantly, to go farther into this, sometimes students become ashamed of their disease, whether that be type 1 or type 2, about how they feel about taking the medication. Sometimes they don't want to feel like they're different than other students. So teaching the teachers, the faculty, and the nurses to kind of help them with combating this disease plays a big part. And then the role of the diabetic educator or nurse when the student has the disease in school, making sure that they're there throughout the day to help with the student when they're taking their medication, whether that be the pills for type 2, shots for type 1, and just any other medication, taking their blood sugar on the meter. The next part I will go into is U100 versus U500 insulin resistance, and then I'll describe this more in depth with my usability test, which I will go into now. The usability test that I did for my final research project and for assessment 6, the purpose was to find the difference between U500 insulin syringes and U100 insulin syringes for dosing situations. The study that I did with the usability test will also showcase the effects of choosing the correct insulin syringe and the correct rapid-acting insulin. The problem that I identified with my usability test was U500 and U100 insulin syringes are sometimes mixed up or or some patients need more than 100 units when they become insulin resistant. Sometimes within hospitals, sometimes in pharmacies, with dosing situations, sometimes U500 and U100 insulin syringes and the type of insulin are sometimes mixed up, and this is kind of a big problem that's occurring. For my test, what I did is I was a moderator, and I had 3 participants come into a meeting room, and I gave them a simple scenario of scenario 1 and a scenario 2, and I asked them what insulin syringes and what dosing rapid-acting insulin to use in the 2 scenarios. The 3 participants that I chose each below consent agreements for these usability tests. The first patient, her name was Karen. She has been a type 1 diabetic for 10 years. Stanley, he's type 2 and he's only been a type 2 for 2 years. And then Taylor is a type 1 she has been for 6 years. Each patient came into the room and I laid out 2 syringes. One was U100 units and then one was U500 units, and 2 vials of U500 rapid-acting insulin, Humulin, and then U100 insulin for Novolog. And these were both not the actual insulin, but it's just water, and then in orange to represent the human skin. For scenario 1, it basically comprised of a type 1 diabetic coming into the kitchen and taking their blood sugar and reading that's 359 and that they wanted to make themselves a sandwich. But at certain points throughout the day, they became insulin resistant. So based on those facts, I then asked 3 participants to determine which dosing syringe and which dosing insulin to use. And then scenario 2, the patient throughout the day became insulin resistant. They were also type 2, and they took their number, and it was also 359, and they were to understand which insulin, the patients were to choose which insulin to use in that situation. From those 2 scenarios, each participant of the usability test, each went in one by one, and they chose what they thought was the best dosing syringe and type of insulin to use in that situation. And for scenario 1, each of the 3 participants chose the right insulin and the right syringe. But then in scenario 2, both of or all 3 of the participants chose the right syringe, but then did not dose correctly. They drew up the wrong amount of insulin for the situation, which could end in hypoglycemia or hypoglycemia. In conclusion, for the entire report and with the usability test, and more importantly, my recommendations for what will help better with combating problems within combating problems for type 1 and type 2 diabetes would be more support groups for type 1 and type 2, more diabetic educators, helping people understand, having more doctor visits specifically, and having pharmacies have more of an impact instead of just giving them each of the type 1 or the type 2 people that have these diseases and saying, like, here you go, this is what you're going to do, and then just come from those recommendations, just kind of forwarding those things to other people, having them understand that these are things that have to be combated. Okay, thank you.
Very good.
We didn't have a question on posting.